The 7 insurers in Singapore will soon have more specialist doctors on their panels, and this will benefit some 2.85 million people here on integrated shield plans. 4 insurers, AIA, Aviva, AXA and Great Eastern Life, have committed to having at least 500 specialists on their panels by the end of the year. NTUC Income and Prudential will have at least 450 and Raffles Health Insurance will have 250. Some have already reached their targets. As at end August, there are 1,235 eligible private sector specialists in Singapore, and 79% of them are on at least one insurance panel. Not all want to be, though, because it often includes pre-negotiated payment rates. This change following complaints from policyholders and doctors alike. Health correspondent Lynette Lai is here to share more. So Lynette, let's set the scene first. What were these complaints?
Okay, so firstly, as you said, we had patients who felt that these medical panels are too small. So for example, if they wanted to get the full benefit of their insurance plans, they would have had to change doctors to a doctor who was actually on the panel. For example, if you see a panel doctor, there's a cap on how much you might have to pay out of pocket, whereas if you see a doctor who's not on the panel, there's no cap, and so generally you might end up paying more. And secondly, the complaints also came from private specialist doctors who were not able to get on the panels. Some of them said, these panels are very exclusive, and they asked why even with a good track record, they're rejected from the panels.
I've mentioned briefly about how many specialists the 7 insurers have committed to. Lynette, how significant will all of this end up being?
First off, we can see from the numbers that in terms of absolute numbers, there's quite a big increase in the number of doctors on all the panels. Some insurers, I believe, are increasing the number of doctors by as much as 63%. Overall, 6 of the 7 insurers will have around 500 doctors on their panels by the end of this year. But one thing we do have to keep in mind that not every doctor is going to be with every insurer, but of course, most policyholders, you are tied to a certain insurer. So that, in a sense, limits the choice that you have. And another thing to keep in mind also is that even though you're bringing a lot of specialists on board, but you have to also make sure that the makeup of the specialists reflects the needs of your policyholders. What I mean is that if, for example, you bring in 200 doctors, but 70% of them are from the same specialty, that's not going to be very helpful, especially since, medicine is very diverse and very specialized.